On February 26, 2025, Hackman, his wife Betsy Arakawa, and one of their 3 dogs were found dead in their home in Santa Fe, New Mexico. Their bodies were discovered during a wellness check after a maintenance worker became concerned when the couple did not answer the door and called local security for help. After seeing the bodies through a window, he called 911 and sheriff's deputies arrived. The maintenance workers said they had last heard from the couple 2 weeks before the discovery. Friends and family had noticed that Hackman had stopped riding his bike a year earlier and that his health seemed to be deteriorating recently. They said he seemed homebound. Deputies found Hackman's body in a state of decomposition in the foyer and Arakawa's body in a similar condition in a bathroom, with prescription medications for high blood pressure and thyroid problems scattered nearby. One of their dogs, an Australian Kelpie, was found dead near Arakawa in a kennel in the bathroom closet, while the couple's other 2 dogs remained alive on the property. A deputy noted that Hackman appeared to have suddenly fallen, with evidence suggesting a similar scenario for Arakawa. On February 27th, the Santa Fe County Sheriff's Department said there was no evidence of foul play, although they did not specify a time or cause of death. They launched an investigation into the circumstances of the deaths. The fire department found no evidence of a carbon monoxide leak, and the remains tested negative for carbon monoxide poisoning. Preliminary autopsy results showed no external trauma to either body. Data from Hackman's pacemaker indicated that his heart stopped on February 17th. At a press conference in Santa Fe on March 7th, police and the chief medical examiner stated that Hackman died on February 18th as a result of severe heart disease complicated by advanced Alzheimer's disease, and that Arakawa had likely died a week earlier on February 11th from Hantavirus pulmonary syndrome. His pacemaker recorded an abnormal rhythm, which was probably the case when he died. The pills found scattered around his body were prescribed thyroid medication. Hantavirus pulmonary syndrome, HPS, also known as Hantavirus cardiopulmonary syndrome, HCPS, is a severe respiratory disease caused by hantaviruses. The main features of the disease are microvascular leakage and acute respiratory distress syndrome. Symptoms appear between 1 to 8 weeks after exposure to the virus and occur in 3 distinct phases. First, there is an early phase with flu-like symptoms such as fever, muscle aches, headache, shortness of breath, and low platelet count. Secondly, there is the cardiopulmonary phase, during which people experience an increased or irregular heart rate, cardiogenic shock, and pulmonary capillary leakage, which can lead to respiratory failure, low blood pressure, and buildup of fluid in the lungs and chest cavity. The final stage is recovery, which typically takes months, but breathing difficulties can persist for up to 2 years. The disease has a fatality rate of 30 to 60%. Death usually occurs suddenly during the cardiopulmonary phase. HPS is mainly caused by infection with New World hantaviruses in the Americas. In North America, Cynombre virus is the most common cause of HPS and is transmitted by the eastern deer mouse, Paramyscus maniculatus. In South America, Andes virus is the most common cause of HPS and is mainly transmitted by the long-tailed rice rat, Oligorismes longicaudatus. These hantaviruses cause persistent asymptomatic infection in their rodent hosts. Transmission is mainly by inhalation of aerosols containing rodent saliva, urine, or feces, but can also occur through contaminated food, bites, and scratches. Vascular endothelial cells and macrophages are the primary cells infected by hantaviruses, and infection causes abnormalities in blood clotting leading to fluid leakage, which is responsible for the more severe symptoms. Recovery from infection is likely to confer lifelong protection. Okay, if you found this video helpful, be sure to like, subscribe, and turn on notifications so you won't miss our upcoming videos. Leave your comments below. We'd love to hear from you and continue the conversation. Thanks for watching, and we'll see you next time.